You are welcome to my channel. I will briefly go through the differential diagnosis of schistosomiasis. This is a disease caused by blood flux. Simply put, it is a parasitic infection. Other name for it is bilharzia. Some call it snail fever, and a part of it is known as Catamaia fever or Catamaia syndrome. This channel will go through A to Z of what we need to know about schistosomiasis. But for this moment, I will go through only the differential diagnosis. With that, let's go. Who needs this topic? Everyone does, but more importantly, healthcare workers in endemic zones and physicians handling travelers who would have traveled to the endemic zones from the non-endemic zones and back to the non-endemic zones. Then, let's check the list. So, from the previous slide, if you see Hepatomegaly, Splenomegaly, Infertility, Hematuria, gastrointestinal tract problems, then be thinking about schistosomiasis. In other words, a physician practicing in endemic zones of the world or a physician in the Western world that is not so much affected by schistosomiasis, but dealing with a traveler who had traveled to the endemic zones, and the traveler is dealing with one of these right now, then you need this differential diagnosis. Is it a central nervous system problem? Then think of schistosomiasis, TB meningitis, bacterial meningitis, viral meningitis, or fungal meningitis. Is there bleeding in this patient? Okay, could be schistosomiasis, could be bleeding disorders, could be as a result of trauma or cancer or some other infection. Are we dealing with problems along the renal system or genitourinary tract? Then let's consider UTI, glomerulonephritis, cystitis, renal cell carcinoma, bladder cell carcinoma, could be as a result of trauma. Is there gonorrhea here? Is there tuberculosis of the renal system? Are we dealing with abdominal pain here? Let's consider small bowel or large bowel obstruction. Is there appendicitis, peptic ulcer disease, cholecystitis, food poisoning, pancreatitis, dysentery, diverticulitis, ulcerative colitis or Crohn's disease, might be typhoid fever, or simply gastroenteritis. I brought out infertility again to let us know that it is a serious matter when it comes to women of childbearing age, that schistosomiasis can lead to infertility. So let's rule out schistosomiasis in a woman of childbearing age living in endemic zone and now having infertility. Or the woman is not in endemic zone, but she has traveled to endemic zone or frequently traveling back and forth between the endemic and non-endemic zones, now having infertility. Let's rule out schistosomiasis. If there's itching, known as swimmer itch, and then we're concerned, let's rule out schistosomiasis, lymphoma, dermatitis, leukemia, maybe liver failure or hepatitis, maybe drug allergy or food allergy. Still on the list will include ascaris, necator, ankylostoma, amoebiasis, cysticercosis, tapeworm, and brucellosis, leptospirosis, or malaria. All these could form part of the differential diagnosis of schistosomiasis. Finally, I will conclude the way I started. The locale, the travel history, will determine the need to check this list while suspecting schistosomiasis. With that, I'm saying a big thank you. Please listen to this again. Rule out possible differential diagnosis of schistosomiasis in that man or woman based on the history, and then make the appropriate determination. Thanks for listening. Please remember to share. I appreciate it.